Alrighty, Marina, what's your view on obesity stigma?
Well, I think it's a big problem that we have right now. When people go into the doctor's office or any medical office and they feel like they're not being listened to because of their weight, and it's just they need to eat healthy and exercise when there could be more underlying problems. If they don't feel heard, then it could discourage them to go to the doctor and keep up with their health. So I think that's a really big problem, and we should be more open-minded and listen to our patients more to make sure that they're getting the correct help.
Alrighty, what is your view on obesity stigma?
Obesity stigma is one that is widely accepted by people, and it shouldn't be. It causes people with obesity and overweight to not seek help for their health issues, and to generally just feel bad about themselves and their lives. I know that I believe that the change for weight bias should come from within. I think that everybody should become aware of when they're demonstrating bias so that they can change it. And I feel like if other people hear and see the change for themselves, that they could change the way that they feel about people with obesity and overweight.
I think that the main thing that we need to focus on to change the way people view patients or people with overweight or obesity is we need to change the way everyone is thinking. We need to educate the general public, we need to educate physicians, we need to educate everyone that obesity is a disease. Obesity is not something that a patient chooses to have. Just like someone doesn't choose to have hypertension, obesity is something that they don't have control over. I get that there are things that are modifiable that can actually worsen obesity, but there still has to be that underlying failure of the mechanisms of the body in order to cause someone to have obesity. So there's something not working right in the body, and if it was working right, it wouldn't matter that the patient gained a little weight. The weight would come back down, the body would keep everything in check. But when a person with overweight or obesity, when they eat too much or when they eat more and start to gain weight, the energy and weight regulating mechanisms in their bodies, they don't work right. So we all have that friend that can eat everything and still weigh as much as they did when they were in high school, and so their situation probably isn't working perfect either, but they're not struggling with overweight or obesity, and nobody blames that person for trying to be too skinny or trying not to gain weight, but we do unfortunately still too many people blame patients with overweight and obesity for their weight when it's something that's very much out of their control.